Do you know what one of the most common causes of death I see at autopsy is? Ischemic heart disease. You have probably heard those words before. But what exactly is ischemic heart disease? Why does it kill so many people? And more importantly, why should you know about it? Well, let's find out. Today, I'm going to take you through the case of an elderly man whose death initially wasn't entirely clear. And when the autopsy was completed, the cause of death was, yes, you guessed it, ischemic heart disease. But this isn't just a story about how he died, because by the end of this case, we're going to look at what his autopsy can teach you about your own heart. This is Beyond the Autopsy, where the dead teach. Let's begin. So, our patient today was a man in his 80s. He had several medical conditions, including high blood pressure, anemia, and he had a history of cancer that was well controlled. But the event leading to his death actually began with something completely different. It was a fall. He fell and fractured his hip. He was admitted to hospital for that and underwent surgery to replace part of the hip joint. Following the operation, he was found to have low blood levels and he was given treatment for that. He was then transferred to another hospital for rehabilitation. And actually, things seemed to be going reasonably well. He was making good progress with his physiotherapy. But then a few days later, his tests showed that he possibly may have an infection. But there was a problem. There was no obvious source of infection seen. Test results for viral infections were negative. His observations remained stable, and clinically he appeared well. Then one morning, he had reportedly been well. His observations had been normal too on that day. But at about 8 p.m., he was suddenly found unresponsive and without a pulse. CPR was started immediately. Cardiac arrest team arrived. They did all they could. They gave him electric shocks during the resuscitation attempts. But despite everything that was done, he was not resuscitated. He was pronounced deceased. And now that's where the important question comes. Why? Well, in this case, there were several possibilities. He was in his 80s after all. He was frail. He had recently fractured his hip. He had undergone surgery. And he had some underlying medical conditions. But then, none of these adequately explain why a man who had appeared stable in the morning will suddenly suffer a heart attack or a cardiac arrest in the evening. So the doctors couldn't confidently give a direct cause of death. And then that's where the autopsy comes in. You know, whenever someone dies suddenly after a hip fracture and surgery, there's something important I want to exclude during the autopsy. It is a pulmonary embolism. A pulmonary embolism occurs when a blood clot, often originating in one of the deep veins of the legs, travels through the circulation and becomes lodged in the artery supplying the lungs. Recent surgery, reduced mobility, and increasing age can all increase the risk. And a large pulmonary embolism can cause sudden collapse and death. However, when I examined his lungs and pulmonary arteries in this case, despite looking for one, I found none. There was also no significant infection in his lung. No major bleeding was seen anywhere. I also examined the site of his recent hip operation. The prosthesis was in place and there was no evidence of an infection. So the obvious complications of his recent surgery weren't explaining his sudden death. When I came to his heart, things became interesting. His heart was slightly enlarged. When I examined the heart muscle, I didn't see any obvious scar. However, some areas appeared pale. Some areas of the myocardium appeared pale. Then I examined the coronary arteries. Now, the coronary arteries are arteries that supply blood and oxygen directly to the heart muscle itself. There are 3 main coronary arteries that we routinely examine at autopsy. And in one of them, I found something significant. It was completely occluded by atheroma. In other words, one of the major arteries responsible for supplying blood to his heart had become completely blocked by atherosclerotic plaque. There was also atheroma within the other major coronary arteries, but they were not completely occluded as this one. When I examined samples of the heart under the microscope, there were areas of fibrosis, which means scarring within the heart muscle. So now we had evidence of significant coronary artery disease, together with evidence of previous or long-standing injury to the heart muscle. that was shown by the fibrosis or the scarring of the heart under the microscope. So the pieces were coming together. His cause of death was, yes, again, you correctly guessed it, ischemic heart disease due to coronary artery atheroma. But what does this actually mean, and what concerns you? To understand how this could cause someone to suddenly collapse and die, we need to understand it a little bit better. So ischemic heart disease, what it does to the heart is this. The heart is a muscle, and like every other tissue in your body, the muscle needs oxygen to survive. Oxygen is carried in your blood. But there's something interesting about the heart. The heart pumps blood around your entire body. But it also needs its own blood supply. So that blood supply comes through the coronary arteries. So basically, the heart kind of pumps blood to itself somehow. And think of a healthy coronary artery like a clear pipe. Blood can flow freely through it, delivering oxygen to the heart muscle. But over many years, fatty material can accumulate within the walls of these arteries. This material is called atheroma. It contains substances including cholesterol and other material. As that plaque becomes larger, the channel through which blood flows becomes narrower, and that means less blood can reach the heart muscle. The medical word ischemia simply means that a tissue isn't receiving enough blood, and therefore enough muscle. Ischemic heart disease is disease caused by an inadequate blood supply to the heart muscle, usually because the coronary arteries have become narrowed or blocked, in most cases by atherosclerosis, but there are other causes. In our patients, this process had become severe as one of the arteries was completely blocked. But now you might be wondering something. If one of his coronary arteries was completely blocked, was there like a massive heart attack? You don't necessarily need to have a massive, obvious fresh heart attack for ischemic heart disease to cause sudden death. Severe coronary artery disease can make the heart electrically unstable. Remember, your heart doesn't just beat randomly. Every heartbeat is controlled by an organized electrical system. That electrical signal causes the heart muscle to contract in a coordinated way and pump blood around your body. But diseased or damaged heart muscle can become susceptible to abnormal electrical rhythms. We call these arrhythmias. It just means unstable electrical activities, basically. Some of them are harmless, but others can be fatal. If the electrical activity of the heart suddenly becomes chaotic, the heart may no longer be able to pump blood effectively, blood stops reaching the brain and other vital organs, the person collapses, and the person might die. This is one of the mechanisms by which ischemic heart disease can cause sudden death, and in this case, a fatal arrhythmia in the setting of severe underlying ischemic heart disease was a likely terminal event. What does this have to do with you? This man's coronary artery didn't become diseased overnight. Atherosclerosis generally develops gradually over many years. According to the NHS, coronary heart disease or ischemic heart disease develops when the heart's blood supply becomes blocked or interrupted by a buildup of fatty substances within the coronary arteries. Over time, these deposits can narrow the arteries and restrict the amount of blood and oxygen reaching the heart muscle. Now, there are several things that can increase your risk, and this is where it gets interesting for you. One is high blood pressure. Our patient had a history of hypertension. His high blood pressure places additional strain on your arteries and your heart and is an important risk factor. Interestingly, in this case, the kidneys also gave evidence of the effects of vascular disease. This was just all evidence that this disease process has been going on for a long time. Another risk factor is smoking. It damages the blood vessels and significantly increases the risk of cardiovascular disease. If you smoke, stopping is one of the most important things you can do to reduce your cardiovascular risk. High cholesterol is yet another. It can contribute to the formation of fatty deposits within the walls of your arteries. Over time, these deposits can contribute to narrowing of the coronary arteries. Physical inactivity and weight can also contribute to cardiovascular risk. Regular physical activity helps your heart and circulatory system. It can also help you maintain a healthy weight. Well, while most of these risk factors we've talked about are things you could change, some risk factors are what we can't change, like family history and age. So our risk of having coronary artery disease increases with age, and family history of coronary heart disease, particularly premature disease, can also increase your own risk. But the fact that you can't control every risk doesn't mean that you shouldn't control the ones you can. So what can you do? NHS recommends several measures that can help reduce your risk of coronary heart disease. If you smoke, consider stopping smoking. Eat a healthy, balanced diet. Be particularly mindful of foods high in saturated fats. Stay physically active. Maintain a healthy weight. Know your blood pressure. Know your cholesterol level. And if you have diabetes, hypertension, or high cholesterol, please make sure that these conditions are appropriately monitored and treated. Also, it's important that we know the warning signs. Coronary heart disease doesn't always first present as sudden cardiac arrest. There may be warning symptoms. The NHS lists symptoms including chest pain, shortness of breath, feeling faint, feeling sick, and pain elsewhere in the body. But the classical symptom of ischemic heart disease or coronary heart disease is angina, chest discomfort caused by reduced blood flow to the heart muscle. But remember, heart attacks don't necessarily feel identical in everyone, so don't assume that serious heart disease must always produce the dramatic, crushing chest pain. If you think you or somebody else may be having an heart attack, please call the emergency service and don't wait to see whether it goes away. Now, the lesson from this autopsy. Let's return to our patient. Numerous medical conditions, just recuperating from a hip surgery, undergoing resuscitation, been well earlier in the day, and then suddenly cardiac arrest. At post-mortem, no pulmonary embolism, no surgical complications seen. Instead, it was just severe coronary artery atheroma, one major coronary artery completely blocked, with scarring seen in the heart muscle under the microscope. Perhaps the biggest lesson from this case is don't wait for your heart to tell you something is wrong before you start looking after it. Know your blood pressure, know your cholesterol, stay physically active, don't smoke, manage medical conditions, and don't ignore concerning symptoms. Thank you for listening to this episode of Beyond the Autopsy. What the dead teach the living. See you in the next one.